Hi, and welcome to Chapter 6, Anatomy over the tibia, fibula, knee, and patella. Let's go through the anatomy of the lower extremity to begin with. What you need to be aware of this chapter is we will be coming back to the femur and hip later on. So next semester, towards the last half of that semester, we'll actually focus on that proximal portion of your femur. We are only going to focus on the distal portion of the femur for this chapter, the patella, the tibia, and the fibula. So the two bones that we're going to talk about right now are your tibia and fibula. There are a couple joints that I want you to be aware of. You have your distal tibiofibular joint, which you've learned from the ankle chapter. Up here on the proximal portion of your tib-fib is your proximal tibiofibular joint, and you also have a joint that falls right behind that patella, where your patella connects with your femur, and that's called your patellofemoral joint. Your tibia is going to be the larger of the two bones. Your tibia actually sits on the medial portion of your leg, where your fibula will sit on the lateral portion. Your tibia is considered the weight-bearing bone, so you must have your tibia, whereas your fibula you could honestly have removed and you could still function day to day with that. So your fibula is located laterally and slightly posteriorly to your tibia. It consists of three parts, and we're going to go through and let's talk about the anatomy on this. So your AP tib-fib. Up here on this flat portion, starting at the proximal end of your tibia, you have these two bumps. These are called your intercondylar eminence. You have a medial and a lateral. They're also called tubercles, so medial and lateral intercondylar tubercles. You have a lateral condyle, a medial condyle, a tibial tuberosity on the anterior portion of that tibia. You have your proximal tibiofibular joint. You also have a tibial plateau, which is that flat surface right around those eminences. Your body, or your shaft of your tibia, and then there's a portion that protrudes out slightly, which is called the anterior crest, which you can actually feel if you rub your hand along your tibia, and it actually protrudes out, and that's what you're touching. The distal portion has a distal fibular joint. You also have a fibular notch of the tibia. Your medial malleolus is also located on that tibia. Your lateral tib-fib, you can see the apex of the fibula. Here's the head of that fibula. Your neck of the fibula, which connects to the body, and this is your lateral malleolus. Your AP knee, again, we're not going to worry about that proximal portion of your femur. I want you to concentrate on the distal end. So we're going to take a look at the patella, which is also called the sesamoid bone. We're going to take a look at that knee joint and that patella surface. So for now, we'll come back to those trochanters in the next chapter, but we're going to focus down here on the back side of the femur. Here you can see your lateral condyle, your medial condyle. Right above that is your medial epicondyle, and right above your lateral condyle sits your lateral epicondyle. The notch in the back is called your intercondylar fossa. Over here above the medial epicondyle is your adductor tubercle, and you also have right above that intercondylar fossa that popliteal surface. Here's your anterior view of the knee. You have your patella, that knee joint, a patella surface, which encompasses that intercondylar sulcus, or the trochlear groove. Again, the posterior surface is where that trochlear groove, you can see that, but then your intercondylar fossa is located right behind there, and it's actually a notch located behind the femur. The lateral knee, you can see that popliteal surface and profile. You can see the patella surface profile, and then that patella in a lateral position. So here again, lateral view. If we were to look up underneath the patella, this is what it would look like. You'll see that intercondylar fossa or notch, medial condyle, the medial epicondyle, your patellofemoral joint, that patellar surface or your trochlea groove, lateral epicondyle, and lateral condyle. Your patella is commonly called your kneecap. It's also a largest sesamoid bone in your body. Your patella consists of the base, which is actually the superior border or the superior surface of that patella. Your apex is going to be the lower portion or your inferior surface. And you have a posterior surface, which is located on the back side. So if you were to lay this down on a table, it would actually lay flat. The anterior surface is what you touch when you feel your knee. So it's going to be a little bit rougher.